Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nic Espanet, bringing you stories of resilience, reinvention, and the real climb to success.
All right, everyone, welcome to the Flex Forward podcast. Today, we're joined by Sarah Tevis. Sarah is the owner of Dallas Functional Dentistry. Looks like they do a lot of neat stuff for their patients over there. So, Sarah, welcome to the Flex Forward podcast. And can you let our listeners know a little more about you and about what you do at Dallas Functional Dentistry?
Absolutely. Thanks, Nic, for having me. This is really cool. Don't do this every day in my day-to-day life, so really cool. Yes, I am Dr. Sarah Tevis, functional dentist in Dallas, and my practice is Dallas Functional Dentistry. And I get a lot of questions. What is that? Well, it's a lot of things. We really do a deeper dive into somebody's health as far as how their mouth is connected to their overall health. So super rewarding for me. It's way more than just, oh, you have a cavity, I'm going to fix it. It is, why is this happening? Okay, so what is your diet like? What is your nutrition like? What is your home care like? Are you hydrated? Are you mouth breathing? Do you have sleep apnea? Do you have chronic inflammatory diseases like diabetes, autoimmune issues, thyroid issues? It's really working in partnership with my patients, physicians, and care team to really reduce overall inflammation. And the mouth is so intricately connected to the body. I'm often the first one that identifies and sees problems that are alarming in somebody. Why all of a sudden are your gums bleeding? Why do you have more cavities than usual? What is your diet like? What are your vitamin D levels like? So it's really rewarding to be able to make an impact in somebody's health. Not only a pretty smile, which everybody wants, but a healthy smile. So it's been a journey. I didn't start out this way. This has been a lot of growth and learning throughout the years, and really looking at my own health and taking that journey. And then my daughter's health. She was diagnosed with sleep apnea as a baby. And I was the one that noticed this and not my pediatrician. So really catching clues early in people's health and really guiding them into the right direction can change their entire life.
We had a similar experience. My middle daughter was a mouth breather, and she had a lot more cavities than her two sisters. And we're like, what is going on? And she had her tonsils, adenoids, and something else. Turbinates, maybe? I don't remember what the third thing was.
Maybe, like nasal turbinates.
Like 2-3 weeks, once all that healed, she was a different kid because we don't think she'd ever slept the night. And I did try to bribe her. Oh, I did bribe her. But it worked for 30 days to sleep with tape on her mouth. And 31 days after she got paid out, she's like, nope, you said 30 days. And I will go in there and she's sleeping with her mouth open. And I'm like, oh, the 30 days of tape didn't get her used to it.
But I bet she slept better. Did you ask her during that period of time? Was she sleeping better?
She did, but I don't remember. She was too young, I think, to rationalize. And then she was probably in 8th, 9th grade when she had the turbinate. I mean, I'm talking about a kid that was, I don't want to say lazy, that sounds, but she just didn't do much to go in and being our kid that's ran a marathon before she turned 18, just very outgoing, doing stuff. And I was like, she never slept. She had not had a good night's sleep, maybe her whole life.
And it's interesting in kids, sleep disorders manifest differently in kids and adults. So a lot of kids get diagnosed with ADD, ADHD, and medicated for it, when really the root cause is the kids are not sleeping. They're not getting oxygen to their brain. And it manifests in hyperactivity or lack of attention, not concentrating in class, and they get misdiagnosed. And really, it's a disservice to these kids not to really figure out the true reason why this is going on. So kudos to you for helping her.
And I think around the same time, I read a book, I think it's called the Why We Sleep, or it was a whole thing on the importance of sleep, which opened my mind up a lot. Cause all the way through school, I'm like, I only need 6 hours of sleep. No matter what, I can get by on 6 hours of sleep. And now as I've gotten older, my body tells me that I can't, but reading that book, I'm like, oh, it might have been more healthy if I would have slept and smoked cigarettes. I'm not saying smoke, but the lack of sleep is so detrimental. It is very close to smoking.
Absolutely.
It's so
brain health, heart health. I mean, that's how people have heart attacks and strokes in their sleep. They stop breathing so many times. So
No, it's
Yeah,
so
I mean, I
that
see
was it's
mostly
a
adults in
blessing.
my practice, but I help parents navigate issues with their kids throughout my own journey with my daughter. But I see a lot of adults now that are they have severe sleep apnea, and nobody's
Hmm.
ever identified that in them. And I help them through getting a sleep study. We can make oral appliances now for people that either CPAPs aren't working, or maybe they're not bad enough to get a CPAP. Or we make different oral appliances that can help with the snoring, the airway, the breathing, coach people on breathing through their nose, mouth taping, love it.
Hmm.
If you can breathe through your nose, mouth taping works wonderfully. I do it on myself. So there's things that you can do if there's a
Yeah,
family
that's awesome, and
history.
it's neat that there's starting to be a specialty that will help. And I've talked to another dentist that something similar. Like we
Mhm.
recognize stuff that people may not go to the doctor for, but
Right.
we're seeing them ideally, I guess, twice a year for their cleanings. If you're picking up and you have staff and hygienists that can help recognize some of
Hmm.
these things
Hmm.
and triage to get them get these getting people to get the care they need earlier before it's a heart
Absolutely.
attack or something that's not recoverable from or
So in
stroke.
my world, things that we look for, my hygienist looks for, and people that may not realize it. Okay, if your blood pressure is not well controlled, okay, what's the reason for that? Grinding your teeth. So people that grind, clench, have these nighttime grinding patterns, it's because their body is in this fight or flight mode,
Mm.
and they're trying to breathe. And so they grind and move their teeth all around to try and gain an airway.
Oh, get it. Okay.
And then we look at tongue, the tongue size, the shape of the tongue. Does it have a scalloped pattern around the
Mm.
edges? That's another clue. And just looking down somebody's throat, can you see their throat, or does their tongue and tonsil tissue take up that
Take it all
airway
in.
and obstruct it? So we are they mouth breathers? If they're mouth breathers, their gums are going to be bleeding, their mouth is going to be dry, they're going to get cavities more frequently. And often it's the spouses or the partners that rat people out, and they're like, hey, we need you to fix him. He's snoring.
We've got a family member. There's a battle. I'm like, hey, you need to go get. Trust me, I have a CPAP, and I'm like,
Good.
I will not. I'm when I go get checked. Like, have you been using? I'm like, yes. If I take a nap, I put it on. I've
Good.
we I had a quick business trip, and I forgot to pack it one time. I'm like, oh no, it's only one night. I'm like, what? This is gonna, and it's awful. Now that I've gotten
Mm-hmm.
accustomed to
Mm-hmm.
it, so I slept on. Try to stay on my side when I didn't have. I think since I've had it probably for 4 years, I've probably not slept with it 2 nights. It's because a couple of times, well, one, I didn't plan on staying at one of my properties, and another time I just rushed out of the house and forgot to get it. And so I think 2 nights out of 4 years that I've not slept with it. And
Good for
it's,
you. That's a
well,
life changer.
yeah, people that don't like my keep trying the different attachments until you find one that works. Because
Mm-hmm. Mm-hmm.
I mean, I got to where I was like, I need to take a nap constantly. It's just because I wasn't sleeping at night. It's
Absolutely.
awesome.
The
So
other thing
how?
we
Go
do a
ahead.
lot of is bacteria testing in the mouth.
Mm,
So patients will come to me from their provider, or just because they're really on this health journey of trying to figure out, I've got gut issues, I have hormone issues, whatever it may be. What is the bacteria microbiome like in your mouth? That is a big clue as to your health. What does that balance look like? And then really optimizing somebody's bacteria through different means, and can be really remarkable and for their health.
when I feel like, man, the last 10 years, but my wife has been a lot more into functional health, but the journey of, your gut health and how leaky gut and just all kinds of stuff and the way we
Mhm.
eat. I joke with her. I used to be able to eat anything, and she got me eating a lot more healthy. And I don't know, have something off the rails once. I'm like, and it just tears me up because I'm not used to that junk food. I'm like, I used to be able to eat anything, and now if I splurge on one bad thing, it kills me, but it's good. I mean,
Yeah,
I think
yeah,
eating something a couple of times a year, you're not gonna. You got to have a little bit, but I joke with her. I'm like, oh, you've ruined me. My stomach used to tolerate everything, but I know in the end it's going to be a much better
absolutely,
longevity. But it's fun
absolutely.
to mess with. So as you've gone through your journey, was there something that you found came easier to you walking this path that others may have found challenging, or what helped you form your where you are today?
Right. Well, years ago, I started seeing a functional medicine doctor myself. Really, I grew up, my mom was a nurse, my dad was a pharmacist, very healthy family group. We grew our own food, drank goat milk from the neighbors. Like, I call them crunchy parents. They were very, very health conscious. So I grew up in that health mindset. I started going through some health challenges early in my career, and my functional medicine doctor was like, hey, we need to do some heavy metal testing. Maybe that's a clue as to why you have this chronic fatigue and other things going on. Well, it turns out my mercury and lead was off the charts. And I've never had an amalgam mercury filling in my mouth. So determined that this was really occupational hazard and exposure of this day-to-day, removing amalgam fillings, inhaling it, breathing it, being exposed to it was impacting my health. And she was like, you need to do some major things differently in your practice or you're going to have to retire.
Wow.
So I started going down this rabbit hole of how do I practice safer, smarter for myself, but then also my patients. And then, you know, you just go down rabbit holes of like, oh my gosh, we were never taught this in school, that maybe it's not good to be exposed to mercury and there's other alternatives. And if you remove them, you need to do it very safely. So I have patients that seek me out just for that because
I've had all mine removed.
Yeah.
The guy in Arlington, he was one of the only people doing it probably 20 plus years ago. And now
Wonderful.
We see another dentist here in Fort Worth, that same mindset.
Yeah. Yeah. So I think through personal experience and just, I'm always learning and eager to know how things are connected. Right. And I'm a bit of an engineer and a scientist, a detective a lot of times, and it just gives me great joy to help impact patients' health, not just their smile, but hey, I want you to live longer, a better quality of life. I want you to breathe better. I want you to feel better. So I geek out on it. I love it. It's really exciting.
That's awesome. I love chatting with people that love what they do, and I can see that in you.
Thank you.
Have you come across any, as you've had anything that podcast or book or anything you could suggest to our listeners that that it's helped you improve either professionally or physically?
Yeah. Absolutely. I think one of the first books I read over a decade ago is called Beat the Heart Attack Gene. Okay, so it's written by Doctors Bale and Doneen, and I've been through their training program. So it is a book written for the layperson. It's not super scientific, about how you can avoid cardiovascular disease and diabetes or reverse it, and how a dentist has to be a part of that team. And it was just so eye-opening. I recommend it to everybody. I have it in my waiting room coffee table.
Oh, look. Nice. I've wrote it down here.
Beat the Heart Attack Gene. And then they have a second one. So there's two parts. And then also The End of Alzheimer's. So Dr. Dale Bredesen wrote The End of Alzheimer's. And again, this is a book written by a researcher that has dedicated his life to Alzheimer's disease, which none of us want, and many of us are affected by it. Things you can do to offset your risk for that, even if there's a family history: diet, lifestyle, avoiding toxins, heavy metals, mouth health, infection in your mouth. So again, he brings in the dental world and the medical world into a really eye-opening way to live a life without dementia. I think those two books, if you're a dentist or not, you're going to get something out of it.
Awesome. No,
and then all the airway books. Oh my gosh, there's so many about breathing. Just Breathe.
His Oxygen Advantage. I feel like I've read
Oxygen Advantage. Yes, McCowan, I think is his last name. Amazing. So yes, how to nose breathe.
I did that where I need to get back, but I tried to exercise just nasal breathing.
Yes. The Batecchio breathing method that he talks about is really cool. A lot of athletes use that to help train for optimal breathing, especially at altitude. So that's super cool.
I read that the Oxygen Advantage around the same time of I think it's called Why We Sleep, but that one went into a lot of the studies of like why sleeping. It's not. One of my takeaways, it's not like your bank account where if you overdraw, you can catch up on sleep. It's like, no, it's detrimental. That's why the Guinness Book of World Record doesn't do how long somebody can stay awake, because they found out even just doing that once negatively affected your health and your life. So it's like, yes, sleep is super, super important.
Super important. And the alignment of your teeth plays a part in that. So I get a lot of adults, and, when we grew up, they pulled teeth to make teeth straighter. Big problem now, because now we have all these adults with little mouths that can't breathe. So now the mindset is we get them young, we expand, we make room.
That's what we did with our girls.
Right.
We went to a functional orthodontist that did the expander for their girls. Weren't very happy with it for a while, but
that's
they will
the way
be
to
now.
do
But
it.
I know there's lots of like, oh, this thing is awful. It's like, yes, you'll be glad one day. I know, just trust us.
Yeah. So when I do Invisalign or clear aligner therapy on my adults in certain cases, but I set it up with airway in mind. So I don't want to close things in. I don't want to squeeze the tongue. I want to make room for the tongue, make room. So widening the arch as much as we can in an adult. It's easier in kids. They're still growing. But I think advice would be, if you're going through orthodontics, make sure your orthodontist or your dentist is expanding as much as they can, making room rather than pulling teeth and shrinking things in.
Yeah, that's my wife. Thank goodness for her. She said, no, we're going to a functional. And I was like, what's the difference? And basically what you said, the old school way was take teeth out to give room, but now we're going to expand. So and it made a lot of sense. Well, great. Sounds like things are going very well. And, it's a lot of people start having more and more success. They also realize there's only so much time in a day. As an entrepreneur or dentist, executive, even, you start thinking of other ways to create income or maybe invest. Have you done any alternative investing, or have any thoughts on anything along those lines?
Wow. Good question. Of course, retirement 401k investing. I'm a big saver, and I don't know. I've had a rental property and things like that over the years, but there's just not enough time to do it all.
For sure.
I think someday I would like to expand and do more health coaching and advising. I've been on boards of many organizations, and I love advising and coaching and being on board. So I'd love to do more. I don't know if I make money doing that, but
hey,
I love sharing my wisdom with people and helping as I can. So.
Well, awesome. Well, thank you so much. And as we're wrapping up the interview, if people want to learn more about your practice or get in touch with you to potentially come in, can you share how best to get in touch with you?
Yeah. So DallasFunctionalDentistry.com, or on Instagram at Dallas Functional Dentistry, or Facebook. So, or give us a call.
Awesome. Well, thank you so much. We really appreciate you joining us today, Sarah. It's been great to chat with you, and always love learning and neat stuff. So thank you so much. And everyone, thank you for listening to the Flex Forward podcast. Be sure to like and share. And Sarah, great to get to chat with you.
Thank you.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.